Thank you for joining us on Aesthetic TV. I'm Dr. Andrew Ordon.
And I'm Stuart Brazell. When you consider how many people get aesthetic procedures, the first thing that comes to mind is that around 90% are women.
And according to research from Medical Insight, men account for 10% of all aesthetic procedures, and that number is rising each year.
And don't men want basically the same kinds of anti-aging results as women? A more youthful look, a little nip here, a little tuck there?
For sure. I mean, and we're going to get into it a little bit. We practice what we preach a little bit, myself and the other doctors. And yes, even during the lean years of the recent recession, the trend has been more men getting more procedures done for various reasons, and we're not talking just vanity.
Joining us to discuss trends in male aesthetics is our expert panel, including Dr. Jorge Perez, a plastic surgeon from Fort Lauderdale, Florida, and Beverly Hills plastic surgeon, Dr. Leif Rogers. Thanks for joining us.
Pleasure to be here.
Thank you for having us.
Oh, and of course, you too, Dr. Ordon.
Thank you very much. I'm glad to be here because I know these two are experts in male aesthetics.
We've all heard over and over what motivates women to seek aesthetic procedures, but what about men? I mean, it is true that women like a well put together man, and whatever women want drives men's trends, right?
You know what? I don't think that's necessarily true. I think, of course, there's a part to that, yes. Obviously, most men who are interested in women want to attract women and impress women, but I think for both sexes, we actually care as much, if not more, about impressing our own gender. So we get along.
We do, and it's only recently that we've been more open about it, coming out and saying that we do care, because maybe in the past it wasn't very manly to talk about taking care of your skin and grooming and things like that, but clearly we're catching up to the women.
I like this because a lot of times we say women dress up for other women, but now I'm seeing that men dress up for other men in a sense.
Well, it needs to be acceptable. I mean, if your buddy's willing to talk about it or says, hey, I do this, then it's that much more okay for you to do it, after you rib him about it, of course.
Now, I can see where a wife or significant other might push their man into your clinic, but what about other reasons why men do it? To improve self-esteem, I would imagine.
Sure. I mean, all the same reasons that women seek plastic surgery apply to men as well. Vanity is not the exclusive domain of women. Men are a little bit more discreet about it. They're a little bit more quiet or tactful about it, but they seek the same types of procedures that women do.
And it makes sense. I mean, if you get a new haircut, if you get your teeth cleaned, you feel good about yourself. And aesthetic procedures for men sort of lend the same type of feeling good about yourself. It's interesting though for men, and I speak for myself. I practice what I preach. I'm into skincare, and I'm getting injections and fillers and Botox, and I've had laser resurfacing. And there's a number of reasons. It makes me feel better. In my job as a plastic surgeon, people are looking at my face and they're sort of judging, well, does he take care of himself too? Does he believe in what he's doing? In a way you are. And that's not just plastic surgeons, but for anybody who's working active, as they're getting older, they want to be at their best.
And I found actually with the economic downturn, I actually had more men coming in. I think it's because they felt like they needed to be competitive in the market, because they were afraid they were going to be phased out because all these companies were getting smaller and letting people go. And looking a certain age, whether it's looking older than they felt they should look in comparison to all their coworkers, felt like it was not an advantage for them. They wanted to have that advantage and be able to compete in terms of the way they look, not just by what they can produce.
That's right. Age range and socioeconomic status may play into a guy's decision. Many older men have found themselves in a very competitive job market where they're going after the same jobs, as you alluded to, as 20 and 30 somethings. So their desire to look younger drives them to seeking out anti-aging treatments.
So it's a kind of, shall we say, practical vanity then?
Yeah, I think so. I mean, yes, men, I think, in general, have a tendency to think that way a little bit more. They tend to have form follows function a little bit more. I mean, obviously, that's not a generalization that applies to everybody, but I think in general, men tend to be that way.
And it's different. as plastic surgeons, our mindset when we get a male patient versus a female patient, it's a little bit different. And we have to be on guard for that male who may be overly narcissistic, and we've all seen them.
So I understand about the competitive job market, but aren't a lot of them newly single? Is that something to take into consideration?
Sure. I mean, we live in a society where fitness and well-being are so part and parcel of everybody's daily life, and divorce is one of those milestones in life. And we see both men and women that are preparing themselves for their new lives by using plastic surgery as one element of it. In fact, I did a segment in South Florida on the divorce makeover, and both men and women seek that just before they start getting back into the market, because they find themselves really feeling that they're at a loss. They've not maintained themselves in some ways. They go back to the gym, they start looking at plastic surgery. They really improve the package in many different ways.
I like that term. We have the mommy makeover, now we have the divorce makeover. And over the years, it was more the women that would come to us, okay, he's out of my life, I want facelift and eyelids and breast surgery because I'm out in the marketplace again. But the same thing holds true for guys.
Sure.
You're seeing some pretty gorgeous women going with younger men, so yeah, you guys got to keep up.
We sure do. And you know, there's
Jennifer Lopez.
Yeah, there's serious quality of life issues as they are trying to address. As they get older, they've ended a relationship, looking for other relationships, and of course the job market.
You know, I remember when we were much younger, 50 was a pretty old age, and as you approach it, obviously it becomes less and less of an old age. But nowadays, 50 really is the new 30. I mean, you go to the gym and you see men in their 50s who are maintaining their shape, they're taking care of themselves. They also fall into that demographic of the baby boomer that has discretionary income. And as Dr. Leif said, they're competitive in their job environment. And so all of these factors play a role in terms of wanting to make sure that they maintain themselves as fit and as physically attractive as they can.
And such a big point is that we have so many new things in our arsenal. Minimally invasive, non-invasive things, beginning with skincare, but fillers and Botox and non-invasive skin tightening, all of those things that for men, maybe they just want to do those easier things.
The quick, easy.
And it works, it pays off. If you combine all of those together, you will stay ahead of the curve.
I've definitely found that to be true in my practice. Most heterosexual men are afraid of the knife.
So talking about men and their different reactions, how is it when you're having a consult with a man versus a woman? Are they a little more emotional, perhaps?
You know, it depends. One distinction is this a heterosexual man or a gay man? And honestly, very, very different in the way you approach it and what they're looking for and what they're willing to do to get it. Since we've really been talking about the heterosexual man.
Yeah.
Yeah, okay. Well, the way I approach it is you have to bring him into it a little bit more slowly. You don't say, hey, let's do a facelift on you. You don't say that. You say, all right, what bothers you? And you start very little by little going into what's possible, starting from the least invasive thing, and then they're like, oh, that's interesting. Okay, what's the next thing that's possible? Because otherwise, literally, they'll be like,
you gotta take baby steps.
Yeah, because they really would just say, I can't, this is way too much, I'm out of here.
Yeah, men are concerned about looking overdone. They don't want to advertise to the whole world that they've had plastic surgery. So the two issues I think that are unique about men is, number one, they don't want to feel like we're going to take them to an extreme. And number two, they're genuinely concerned about pain, much more so than women are.
That's true.
Pain and recovery, because they have to take time from work, the more practical aspects of the surgery. But definitely there's a difference in pain tolerance between men and women.
So touching on that, what kind of procedures are they ultimately asking for?
Well, that's such a great question, and Medical Insight did do a poll, and according to the poll, the top surgical procedures include liposuction, nose jobs or rhinoplasty, eyelid surgery, gynecomastia, or male breast reduction, as we call it. So the non-surgical favorites include laser hair removal, non-invasive body sculpting, neurotoxins to cut the wrinkles, and dermal filler treatments to cut the lines.
Now, Dr. Perez, what are you seeing in your practice in Florida?
Well, I have a little bit of a unique demographic in South Florida because we have two things that are a little bit unique to South Florida. Number one is that we have a very fitness-oriented society. we have beautiful weather all year round. So in the wintertime, guys can't just put on big bulky sweaters and hide those extra pounds. So what Dr. Ordon said is exactly correct. We see a lot of liposuction, body sculpting procedures. In young men, for example, gynecomastia is also a very popular procedure. That's actually a separate entity unto itself for teenage boys that is actually worthy of a separate conversation. And then the other demographic that we've got in South Florida is that we've got a very active and vigorous elderly population. All the snowbirds come down in the wintertime, and so I do a lot of facial rejuvenation, the eyelid surgery, as Dr. Ordon mentioned before as well, neck lift and facelift surgery in men who are in their 70s and 80s who are very physically fit. They're not the typical 70 or 80-year-old. They're playing golf and tennis and really working out.
And want to date. A lot of them want to date and see women. Some of them may have been through a divorce, as we touched on,
Right.
or lost their spouse over time and want to get back out in the
And live that
dating
good
arena.
life.
Yeah.
And the odds are very favorable for them in South Florida.
Absolutely. And Dr. Rogers, what about you in Beverly Hills?
Well, in Beverly Hills, I really have two segments of patients. I have straight patients and I have gay male patients. Now, what they ask for is not that different, other than it being, we start out with the less invasive things, more for the straight men, and you end up going for the more extreme, more invasive procedures for the gay men. That's really kind of the trend, but it kind of covers the whole spectrum. So we also have quite a few non-invasive techniques. So those things that were mentioned are absolutely true. The non-invasive body contouring and some skin resurfacing, less so, because again, I don't think they want to have the downtime. If they're into that, they don't want to have to walk around looking funny, but they'll do anything without downtime. Now, if you start talking about surgical procedures, very similar to Dr. Perez's experience. Eyes and necks, very, very common. Body contouring, extremely common. And again, the gay men tend to pick these quicker, just because and I think in some respects, aesthetics for them is more important.
It is, it's more important.
Yeah, and they pride themselves in the way they look. I think the community prides themselves on that, more so than the heterosexual men. And frankly, women are more forgiving than men. So.
Very true.
Yeah, it is.
We also have we have a very active and very busy gay population in South Florida. And the other component to that is that they have a lot of discretionary income, and so they are willing to spend that on themselves.
That's absolutely true.
So, my perspective, we didn't touch on rhinoplasty and chin augmentation. I think those are two of the biggest things that we do for men. Some younger men and some who've just put it off, who want to look better later in life. But it's interesting to discuss the difference between doing plastic surgery on men and women. For men, less is more. That, if given, for example, doing a nose on a woman, they're there because they want that feminine, stylized, refined nose. That nose isn't going to work on a guy. So we have to take our foot off the pedal a lot of times. Our mindset is not to eradicate every wrinkle and just get things so tight, because the minute you do one of two things, either make a man look unnatural, done, or feminized, unless they want that.
Right, and that's a different
See,
population.
and that's,
Yeah.
when will you
Yeah.
make my eyes, will you change the
Yeah.
shape of my eyes? And we get that request, but there's a big difference. So we have to really be attuned. For example, eyelids for men are totally different. Our mindset is not to remove all that skin and all that fat, because they would look hollowed out, they would lose their expression.
Right.
And a guy with no wrinkles, each one of those lines has a story to it. You want to leave some. I know
Women
it's
find wrinkles sexy.
I know,
We
and
do.
it's
We
almost.
like some life.
I know it's almost unfair that we get along. We get away with a lot more in terms of aging, and
like
it's
your fine
accepted.
wine. You get to
For
age
women,
beautifully.
it's tougher.
Yeah.
And it's true to that, straight or gay. Actually, the gay men that come to my office also say, "Don't make me look done." That's the number one thing they say. So it's very important. And like you said, doing surgery on a man is very different. Doing a face on a man, we do facelifts on men all the time, but it's a totally different operation.
So doctors, for our viewers at home who might be watching and considering a treatment, what advice would you give them?
Well, I think number one, go to experts like we have here today, because without question, talking to these two surgeons, they deal with men all the time, and they have a real pulse. They've been around a lot of men, young, old, heterosexual, gay men. Everybody's a little bit different. You want to go to somebody who has done plastic surgery on men.
The hard part is knowing who that person is. So especially for men, because again, men are less open. So you're less likely to get a referral from another man, but that would be the ideal way. You can always look at someone's pictures before and afters, which just give you some indication, but that's not always accurate either, because most people are putting their best pictures forward. So it can be a little daunting at times, but do the research.
You know, men tend to be pretty good at interviewing. A lot of them just professionally do that as part of their job, and it's no different choosing a plastic surgeon. I mean, have several consultations, talk to them, get a sense of whether you're really connecting. If your desires are what that doctor has in his mind or her mind, and you can kind of imagine what your result is going to look like, and you feel like there's a genuine connection and they're understanding you, and they're taking their time to explain everything in great detail, especially with men, again, related to recovery, because men have a limited amount of downtime and they want to recover very quickly. That personal connection is very important.
So feel free to ask as many questions as you need. That's
Yes.
great advice. Well, you know, this has been such a thought-provoking discussion and just such a great panel. And I'm so glad that you could join us to tell our viewers and reach those males who are interested in male aesthetics.
Well, you're so right. I've enjoyed this. I've learned from our experts here. And thank you, Dr. Perez and Dr. Rogers, for joining us today. And I think you've answered a lot of questions for our men viewers out there.
And thank you to Dr. Ordon.
Thank you, Stuart.
And thank you for watching. I'm Stuart Brazell for Aesthetic TV. Stay tuned and stay beautiful.